I don't think we're looking far enough into the future, because come the autumn, we're going to have millions of people on NHS waiting lists, women with breast lumps that are going to be diagnosed late. We're going to have a cancer outbreak after this. We're going to have a TB outbreak after this. So we're definitely not being told a whole story, I think, along these lines. But we know now there's hundreds of and thousands of extra beds. It's just, what gets me is the way the narrative keeps changing. You know, first of all, it's going to be 500,000 are going to die. Then we've only seen 30,000. Then the lockdown's going to be released after the curve is flattened. The curve is flattened now. The goalposts have moved. You know, then you've got to say we can't do anything until there's a vaccine. Then we very well know that there may never be a vaccine. You know, it's all becoming a bit blurred around the edges now.
What's going on for you as a nurse on the front line on the NHS? What in fact is going on, Sally? Can you give us shed some light?
Well, I wish I knew what was going on. It changes daily. I don't think anybody actually knows exactly what is going on, and it's something so new. It seems to be unprecedented. We've never done this kind of actions for any other illness in the past. And I just really, at the moment, starting to think it's not panning out as it was expected to. You know, we've made preparations for the worst, and that doesn't seem to have happened. But I don't think they can backtrack so quickly as so much has been invested. So we planned for, you know, 500,000 people to die, in addition to the usual deaths. And it's taken many weeks of this year before we've seen an actual increase in deaths over 5-year averages. So
what you're saying is the 5-year average of a normal year wasn't really happening because the numbers just were not like they said they would be.
No. So, you know, the model that the government seem to have used is based on something Professor Ferguson produced, and he's the guy who was broke his own advice and had his girlfriend round, a married woman round. So he obviously doesn't believe his own model.
Wow.
It's all just starting to fall apart, and I just don't think that the government, after spending so much money, can just backtrack immediately. That's why we're going to see a gradual releasing, because you cannot stop a virus or nature from happening.
So okay, so there's so many questions to ask. Number one, do you believe that there is a virus going around and that people with low immunity are more prone to catch this virus?
I definitely believe there's an illness. I mean, when it first happened, I was completely signed up to it. There were people with this new respiratory disease suffering in significant numbers. You know, and every loss of life is a tragedy, but we've seen much bigger losses of life, and we've never invested this much either money or time or effort into treating or managing those illnesses. So I really thought this one would be different. I mean, we've been expecting pandemics. I mean, the average was every 40 years. So we should always have been prepared. But so far throughout my working history, those pandemics have never, you know, they've fizzled out before they've become the Spanish flu type pandemics. I mean, we've had Ebola, avian flu, swine flu. I mean, even from HIV, from when I was a teenager, we were terrified into think this new virus is out there and it's going to kill us all. I mean, it's killed millions and millions of people, and it still does. 40 years later, there's still no vaccine. So how this narrative can be, well, you know, we can't do anything until there's a vaccine, it's starting to worry me a bit.
So what is your worry then about the vaccine? And before I actually ask that about the vaccine, can I just ask you, have the people that have died, have the COVID wards in the hospital you've been working, have they been full?
Well, I don't work in. I work in maternity units, so I don't work on a medical ward where the COVID cases you would expect to see the severely ill in those cases. But we know now there's hundreds of and thousands of extra beds. It's just what gets me is the way the narrative keeps changing. You know, first of all, it's going to be 500,000 are going to die. Then we've only seen 30,000. Then the lockdown's going to be released after the curve is flattened. The curve is flattened now. The goalposts have moved. You know, then you've got to say we can't do anything until there's a vaccine. Then we very well know that there may never be a vaccine. You know, it's all becoming a bit blurred around the edges now.
And what about masks? Because what do you think about mask wearing? There's a huge war becoming apparent between people.
The masks. So you would have noticed the narrative's changed over that in the media. So it started off, you know, these masks are for surgery. For a virus to stop yourself catching a virus, you need a fitted negative pressure mask. That's the only way you can stop it. I mean, you wouldn't go into Wuhan lab in a surgical mask because viruses are tiny, you need a massive microscope to see it. So it's going to pass through. I mean, people making masks out of t-shirts, it's not even going to stop pollen and dust getting through. It's never going to stop a virus. So masks, surgical masks, they're only good for a few hours. They only are protecting the patient. You know, surgeons are wearing them so that their saliva and anything that you breathe out don't go into a surgical opening. So they're only good for a few hours. You need to be trained in how to put them on, take them off. You know, to find masks discarded on the floor across the country is actually a worse health risk.
Would you wear a mask in a supermarket?
No, I wouldn't. No, because it's yeah. I wouldn't, and I think the narrative has changed. At first, the government was saying it's not worth wearing a mask because it's not going to stop you catching or passing on a virus. And when you see people wearing them, they've got big gaps around the side. They're not fitted. They've got their nose hanging out. So now I think we're going towards masks because we've put so much fear of death into the population that when we have to let them out to get back to some resemblance of normality, people are going to need a crutch, something to help them feel safer about going out. And now this mask is going to be this safety crutch, even though they're not training people how to put them on, how to take them off, how to discard them properly. So there's massive, in voids, in bubbles, in sterile bubbles, a mask might be preventative or protective in some way, but out there in the wider population, it's not really going to be a...
So I won't wear a mask because I just got this feeling that this control thing, and I know there's so many people that think that is wrong, but I remember in my own case when my husband was dying from cancer and I had to put a mask on to go in the ward, the nurses and doctors told me it only works for like a very short time and it doesn't really actually work at all. And it's more of a mind thing, isn't it? Make people feel safe.
Yes. So, and I think that's the thing now. We've put everybody into such a fear. I mean, you cannot... People think we're stopping the spread of the virus. We're just actually slowing it down. And you will see the narrative's changed so many times. So at first it was, we need ventilators. Then they realised they didn't need ventilators. So they went to test. It's now they want to track. It's just not making sense, joining up the dots. I think something's going on, but no, we won't be told. And I think we've only got ourselves to blame. I mean, when a government announces something big, stockpiling toilet roll, common sense seems to go out the window. I mean, and if we were really told like something like it was a genetically modified virus released as biological warfare, the government's not going to stand up and tell us that, because we'll have riots and social unrest and I mean, stockpiling toilet roll would be a tame thing. So we're definitely not being told a whole story, I think, along these lines. But it's unprecedented that people's health has suddenly become so important for one issue. I don't think we're looking far enough into the future, because come the autumn we're going to have millions of people on NHS waiting lists, women with breast lumps that are going to be diagnosed late. We're going to have a cancer outbreak after this. We're going to have a TB outbreak after this. I mean, are we planning towards that? We've already spent 2 years NHS budget on 3 or 4 months of trying to tackle one illness that, although it's been devastating to a lot of families, what we was expecting, what we was told to expect, hasn't really manifested. So I don't know. I'm more worried about looking to the future, because everybody's quite happy to stay at home, getting a percentage of their wages. Summer days, you know, have a glass of wine and it's not all that bad, and I'm safe because I'm at home. But then come the winter, when the government assistance stops and millions of jobs are lost, and the NHS has got a backlog of 8 million people to see, we're in for a really bad winter. We're going to have millions of unemployed, and suicide's going to go up, you know. Abject poverty.
Isn't it all a lot of fun, isn't it? This is enough. I mean, I know my eldest son is, you know, he lives up north, and I know he's been very fearful, and I know it's so easy to step into that vibration of fear, which is actually really damaging to the immune system.
Exactly, and I find that, you know, the immune system needs stimulation to work effectively.
Exactly. We need viruses.
We do. We need viruses. We need bacteria. We need contact with people, because the less you're safe in your family. I mean, in your family home, you're all exposed to the same germs, bacteria, viruses. You go out, it's other people's viruses that stimulate, and bugs that stimulate your immune system. And we've heard medicine, drugs, vaccines, but we've heard nothing about boosting our own immune systems, things we can do for ourselves to take control. Everybody wants the government to tell them what to do. Everybody wants the government to tell them how to live their lives, and then they're confused. And this is a massive way of gaining a whole lot of control over a population. It doesn't make them easier to manage, and you find we succumb to that so easily. I mean, I've brought into it for many, many weeks, but I can't see how keeping children isolated, if I was at home for 12 weeks, I'd put on 2 pounds, I'd become chubbier and sluggish.
Yeah.
And that's exactly what's happening to people's immune systems. So it's when we look to the future, we're going to have a scared populace with weak immunity. I mean, it would only take nature to come up with one new virus or a mutation of an existing virus, we're all going to go down again. So
exactly, and this is what's appalling me, is the fact that there's nothing really at all being spoken about immunity, and how we have a natural immune system in our body and how we can strengthen it. And what we're hearing is that those that are dying from it have got very weakened immunity. I read that 25% of people in the UK that have died are diabetic.
I've read that too. So obesity seems to have a big impact as well. And
yet the food stores are full of sugar. I mean, it's just bonkers, isn't it, Sally?
It's bonkers. I mean, and then you'll hear that Africa's got a low incidence, but the average life expectancy in Africa is 61. So, but we haven't spent billions and pounds and shut down the world trying to increase the life expectancy of Africans. It's beginning to seem to me like I'm not sure it's about health anymore. How could we just be a one issue health service? I'm worried about the future in health wise.
Yeah, and so would you say that it's time for us to take more self-responsibility for our own health?
I've absolutely, been against the government telling you what to do and how to live your life. I mean, they should give you the information, and this is how every other illness has worked throughout civilization. The government tell you what harms you, and then you make your own choices about whether you're going to do it. You know, there's not a single person on this planet, you know, that doesn't know that smoking is bad for you, but there's still a percentage of people that will do it despite. And we don't stop selling cigarettes, they're still given a choice. But here we're not given a choice. The fact that lockdown is supposed to be a temporary measure, that it's been put into the law, that can be reactivated at any time, just makes me think in 2 years' time, will the government be able to say, oh, we've got another disease circulating, everybody in their houses again? And it's concerning, and encouraging neighbours to call the police on their neighbours. I mean, that reminds me of stories I read about the Second World War. That's how the Nazis found the Jews, was getting the neighbours to report it. So there's some things that are a bit, you know, without any knowledge of what your neighbours might be doing, you're quite happy to call the police and
very
and report them. You know, these are scary times in many ways, above and beyond health terms and viruses. And
Sally, have you heard anything? Because I did a Facebook Live the other week. It's ended up going viral, actually. Someone said it's on Twitter now.
That was me.
Oh, yeah, but a few people told me it was on Twitter. That's how we got in contact again. You said, I've just seen you on Twitter.
Yeah.
Have you heard stories about relatives being asked to, you know, choose the COVID, even though it was the final nail in the coffin?
No, luckily I work in an area where we don't have a high death rate, so...
Okay, so you wouldn't know about any of that?
No, I wouldn't.
No. So what's your overall thoughts then on the whole situation in terms of...
It's going to be good to see if we've improved cardiac disease by 25%. You know, it would be good to see these figures later on, but this is going to be, you know, hindsight is going to be a wonderful thing. So I think only time's going to tell on this.
So what would your advice, because like I've been really promoting this whole idea of take responsibility for your health. It seems like this is a massive wake-up call. You know, most of us, myself included, took my health seriously when I got a disease. That was when I changed my health. This is a massive wake-up call for people to take responsibility and not wait for the government to tell them to take 5 a day. I mean, 14 a day is the minimum we need in our bodies, you know? Exactly. And it's like the government, unfortunately, when people are being dumbed down so much by outside influences, such as the government, you know, and unfortunately the doctors don't learn about nutrition, you know, fresh air, negative thinking damages the immune system. We're not taught any of this.
No, you know, fear is one of the biggest dampeners on your immune system.
Absolutely.
So if you're terrified, your immune system's already going to be lowered. But now we've got this terrified population because wherever this virus came from, and whatever it's, whatever way we're managing it, we can't stop it. We can't stop it. So we're just slowing the spread. And I know. I mean, and the narrative has been protect the NHS. Why wasn't it protect people, protect human life, protect the NHS? It seems a strange way.
I agree, and I'm sorry. I've had this conversation with a few people, and I get that the NHS have done an amazing job. And why wouldn't I? I'm somebody who like promotes love and authenticity and transparency. But there's something for me weird about, I didn't mind the first 2 nights. There's something about clapping on the doorstep on a Thursday.
I've never done it. So it's just like the NHS can do no wrong. So you talk about taking responsibility. The NHS pays very well their chief executive, more than the Prime Minister. But procurement officers are employed by the NHS. They get paid very well to make sure that we have what we need when we need it. But everything is the government's fault and not the people who are supposed to be buying it and the people managing those. It seems like we have to, the NHS is above any sort of criticism or responsibility. It's just like trying to deflect off the NHS and blame the government. I mean, if it was my job to buy, I don't know, paracetamol for the NHS and it ran out, in a normal situation, my boss would say to me, "Why have we got no paracetamol?" You know, you would have to take responsibility. So I'm a big believer that it happened to the NHS, and now you've got your neighbours saying number 11 weren't out clapping. It's creating more division and more. Well, it's more judging of your neighbours for what they're doing during this.
Oh God, there's all that going on as well, isn't there? I've actually found myself, I've actually not got rid of some friends, sounds awful, but I had to put the phone down on a friend of mine last night who I reached out to because he doesn't have a family or anything. We have very different political ideas, and he was just praising Bill Gates and praising all these, vaccinations, and I couldn't listen to what was being said, and it is causing division with people, isn't it?
Yeah.
Sadly,
and that's another way that you can find you control your people. So you pit them against each other, and then they don't unite against the person or the government.
So just coming back finally to vaccines, Sally. What's your take on vaccinations?
Well, as you know, I give vaccinations for a living, so I've always been pro-vaccination. But like I said, with HIV, it's been 40 years in the making, and there still is no vaccination available. So to say we're going to continue along these lines until there's a vaccine available, that's moving the goalposts again, and we may never have one. And not all of them, no vaccine is 100% effective. So we're back to this herd immunity. So you're going to have you can stimulate the immune system on a healthy immune system, but still there's all those people out there with no immune systems or like cancer patients, very weak immune system. We're still not going to be able to protect them. Although.
So all of this, so what you're saying.
Spreading it. So this virus isn't behaving like any other disease I've ever known or can think of. I mean, maybe some of your viewers can help me, but I've racked my brains. Viruses and illnesses affect old people and children, and that's always been the case. And I don't understand why children aren't being affected. And now, when that evidence became apparent that it's not affecting children in the same way, there's another new syndrome or illness out there that is supposed to be affecting children as a result of this. So, be very interested, keep watching to see what is going on with that and how prevalent that turns out to be.
And what about the idea, though, that the ventilators were actually making people worse because it was more of one of these, like when you're up in a mountain, the oxygen was different, and that the ventilators were making people worse?
Well, if you need a high pressure ventilation, it's always going to damage your lungs slightly because you're forcing them.
Right.
I mean, you're forcing air in there under pressure. So anybody who needs ventilating for any illness is likely to end up with some degree of lung trauma. Ventilators go on different standards, so you can go from a Reliant Robin of ventilators to, the Mercedes of ventilators. So it's a new disease. So we're not treating the virus. We're only treating the symptoms that people present with.
That's all they do in the NHS, though, isn't it? That's all doctors ever do.
Yes. So we're only ever treating that. So when it presented as a lung breathing condition, then doctors it's right that they're going to fall back on what they know has saved lives in the past. When other doctors are now saying that it's more like an altitude sickness, you need higher oxygen levels rather than the pressure being pushed in there. So that was a learning curve that you're going to always get with any new illness. But there's always going to be. I mean, take heart transplants. they practiced on those for years before they actually did a live one, and then they still tweak it to this day to make it less traumatic for the patient as we're learning. So doctors are doing the best they can with what they know at
Absolutely.
the time, and then when we know better, we have to do better.
But do we not know better that we should be telling people more about how to improve their immunity? This is what, I mean, I love what Lily's just said. She said, I think children are not being affected because they're so happy their vibration is so high and so they're less prone.
Well, that's a possibility. They're not as, well, not all of them, I suppose, but they have got a more accepting disposition. They seem to take this on the chin and be quite resilient. So it may well be, unless we need 20 years to look back on this, I think, to see what it really is and was. But that makes complete sense.
Yeah. Oh, do you know?
I was saying the other day, this virus is from China. If you look at China, China had a one-child rule for many years, which led to an overpopulation of men. So this virus seems to act on men. It doesn't have a very good social care system, so it gets the people out of society who need the most social care. It is. It's going to be interesting.